From Bristol to Belfast, screaming it to a beat in London and freezing in Wrexham. The message from tens of thousands of striking nurses is the same across the nation. Today's strike is as vast as it is historic. The first time in the Royal College of Nursing's 106-year history, its members have voted for industrial action. For Shelley and her student nurse son, it wasn't being underpaid, but overworked that led her to the picket line.
You get the odd shift where you'll get the amount of staff that you need, but a majority of the time you don't get that. So this is what today is about for us. It's not about the money, it's about getting out there and getting some more staff. And if we can help with increasing that money, then other people might want to come in and say, oh, I might want to join the nursing profession.
We have been undervalued.
The nursing union is calling for a pay rise of 5% above inflation, so an increase of about 19%. In a cost of living crisis, it's desperately needed, says Shelley.
We're working extra shifts. We're going to burn ourselves out if we're not careful, because we're putting got to be now £60–70 on our gas meter every week because we're just burning through it. It's so cold. I need to keep the kids warm, and yeah, everything's just a little bit tough at the moment.
The average nurse's pay has increased by about 20% in cash terms since 2010. But over the same period, prices have gone up by 32%, so nurses have had a real terms pay cut. Their pay has not increased by as much as private sector workers, up 41%, or even other public sector workers. The government, though, is refusing to increase a pay offer of £1,400 for the majority of nurses.
But we also recognise the huge contribution that we saw from nurses during the pandemic, and that's why last year we made a special case where nurses got an extra 3% when others in the public sector did not. But we've got to balance that against what is affordable to the wider economy, and asking for a 19% pay rise way above what most viewers themselves are receiving is not affordable given the many other economic pressures that we face.
As of right now, talks have stalled and more strikes are scheduled for next week.
This isn't just about pay, it's about working conditions, it's about staff being stretched, they say, to the limit. It's about not being able to provide the care they want to give, and underpinning all of that are major gaps in the workforce. So the point, they say, is just unsustainable right now.
Of course, low pay is one of the reasons for those gaps in the workforce, say nurses.
Yeah, always mental health nursing, yeah.
Paul is talking to us on his lunch break from his new job at a private hospital.
Basically, my pay just wasn't really holding up to the cost of living increases, and I've had to borrow money from my brother and things like that, and also use credit cards and things like that, but I just couldn't afford to do it anymore. So when I was asked why I was leaving, I actually just said I can't afford to work here anymore.
Did you ever think you'd leave the NHS?
No, not at all. Never. I thought I'd work there till I retired, yeah.
Critical services like A&E, chemotherapy and kidney dialysis are running as normal today, but thousands of appointments have been cancelled, like Neil's treatment for blood cancer.
So they've put us through to next Monday, but because of the RCN strike or the proposed RCN strike on Tuesday, he then has to go back on Wednesday.
Neil, how do you feel about your appointments being cancelled?
I have sympathy with the nurses, naturally, but nevertheless, yes, it's a bit inconvenient.
Nurses in Scotland today refused a pay rise offer of 7.5%. The government in Westminster is refusing to negotiate on wages, and 3 more medical unions are getting ready to strike. Today was historic and, evidently, just the start of a debilitating dispute.
Paul McNamara there. Well, earlier today, I went to chat to nurses at the Leeds General Infirmary Hospital who've been out on the picket lines in the cold protesting. Many of them told me they were feeling burned out and demoralised over low pay, but torn about the decision to walk out.
It was a mixed emotion whether should I come out or not, but I think now is the time for us to stand up and speak for us.
How hard is it surviving on a nurse's salary?
It's very difficult. I'm a single mum. That in itself is really hard. trying to work, cover childcare, the cost of living at the moment. Yeah, it's hard.
I came into this job to work hard for my patients, but I am so burnt out now. You know, I haven't done a shift in 6 weeks with the second nurse, and that means I can't take a break. I legally can't leave the ward because I have the meds keys in my pocket. You know, any other job, imagine if you did 13 hours and you didn't have a break, you didn't leave your office, you would think that was unreasonable. I'd be honest, I'd cry in cupboards. I can't, you know, it's a really awful job, but it is also a job that I absolutely love, and I'm very passionate about how much I love my job. I chose to come into a service that is well funded, well staffed and well looked after, and that's not what we're in at the moment.
What would you say to the Health Secretary if he was right here now?
I'd say you couldn't run a bath, sir, or madam.
Sir now.
Sir,
oh dear.
I can't keep up with the change in this government.
Would you like a compromise, that you come to somewhere in between what the government's offering and what your union's asking for?
I think a compromise is realistic. I think with anything, you aim high and you compromise in the middle. It's any kind of negotiation.
I think 19's probably a bit unrealistic, honestly, but I think 4.5 is a bit of a kick in the teeth, or whatever it is that they're offering, and I think actually that would mean people would come out with less.
You've got a lot of people beeping all the time.
Yeah.
Do you think that public support is going to last?
Tough to say. I'm surprised to see it today.
Why?
Because some of the stuff that I've seen and heard from on social media hasn't been very positive from friends, family. So actually to see other unions come out and support you, for all these public members beeping their horns and saying that they're in support of us, is great. Like, it makes me feel really good inside. I don't think it will last.
The views of nurses on the picket line here in Leeds. Well, earlier I spoke to Matthew Taylor, the Chief Executive of the NHS Confederation, which represents health service employers, and Patricia Marquis, the RCN's England Director. I began by asking whether the RCN considered today's strike a success.
If striking's ever a success, but we have had a large turnout on our picket lines. We know that members feel their voice has been heard. And we know that by and large, we've worked well with employers to ensure that services are safe. So I think if you use that as a yardstick, success, yes. Has the government listened, which is the real success? Who knows?
Well, when we look at the services affected, high priority cancer surgery has been cancelled, A&E not properly staffed, mental health services affected. Does that, in all honesty, weigh on your conscience?
No, I'm not sure that I agree that that emergency departments haven't been properly staffed. From the calls that we've been having, we've been confirming that by and large the services are staffed to an adequate level, in some cases to higher levels than they are normally. There has been some cancer surgery cancelled, you're absolutely right, but priority cancer services, emergency cancer and very urgent cancer treatment has all gone ahead today.
Matthew Taylor, have you got any data on how many operations, how many appointments have been cancelled across the country?
No, that data isn't collected. And I think we have to have an honest conversation about this. There's no question that industrial action causes harm. It would be odd, wouldn't it, if vital members of our workforce were not to work and it was not to have an impact. And, you know, when we talk about routine operations being cancelled, that word routine, it's not how it feels if you're a patient who's been waiting a long time and are told you're going to have to wait 6 weeks. So, you know, there are real harms that result from industrial action. We are very grateful to the trade unions for working with us to try to minimise the life and limb risks of that. And I think today has been managed as well as can be expected, given the nature of industrial action. The spectre is of more industrial action unfolding over the winter, and we mustn't take today as a grounds for complacency.
Right, Patricia, that's the point, isn't it? You're going to escalate from here, aren't you?
If we need to, we will and we can. But just coming back to Matthew's point around the disruption, of course it's been disruptive, but that's different to saying, have we caused harm today? Any more than is caused every single day by the disruption that is caused because of the lack of funding. So patients wait for months in some cases years to get surgery already. People wait too long for ambulances, they wait too long for beds once they're at a hospital. Those disruptions are being caused every single day because of the lack of staff that there are. So I don't want anyone to think that today, as it has been disrupted, but in a different way to the services are disrupted every single day across the UK.
Matthew, you're nodding at that, so you sympathise with that argument.
It is certainly the case that even if we had no trade unions and we had no industrial action, we would face a workforce crisis in the health service. We have 130,000 vacancies. So, we've got problems with recruitment, with retention, and with motivation. So what Patricia says is absolutely true. But of course, as Patricia knows, in the middle of winter, when you've got those kinds of challenges, when you've got, and we saw the data today, on highest level ever of 111 calls, ambulances waiting outside casualty, then in those circumstances, any additional pressure on the service, is highly problematic.
Patricia, some of your members on the picket lines today here in Leeds were worried that public support would fade and was already potentially fading. There's some polling evidence to back that up. Are you concerned about that?
Of course we are, absolutely. Keeping the public on side is absolutely critical to our success. And we have to send a really strong message to the public from our members. And I'm sure you heard this today on the picket lines. We care deeply about the impact that any of our action is taking. But the very reason that people got to the point of ticking yes and walking out today and being on a picket line, freezing cold and losing pay, was because they cannot do the job that they want to be able to do. And it's physically, mentally exhausting, but it's morally just injustifiable for them to try and continue doing that. So I think that we would say to the public, please stick with us. We're in this for you and with you.
Matthew, the reality is the longer this goes on, the less public support there'll be for it, isn't it?
Well, I think the reality is the longer this goes on, the greater the impact on the health service and the greater the risk to patients. And I think that in as much as the public looks on any action and sees what kind of impact it has, there will come a point when the public will become increasingly anxious. Whether they blame the government or blame the trade unions, I can't say. But we cannot drift into a winter of industrial action without severe consequences.
Matthew Taylor, Patricia Marquis, thank you both very much.